So the TFL, or the tension fascia lata. Now this muscle actually comes off the IT band and attaches to the top of the hip bone. And this muscle actually aids in abduction, internal rotation and flexion of the hip. So this release I'm going to show you for this can actually be quite beneficial for individuals with things like back pain or hip pain. So you can use a foam roller for this, but I'm going to use a trigger point ball. This I use for everything I do, I just prefer it. So what you're going to find the TFL first. So if you find the hip bone, you can actually start to feel where it begins just to drop off. Follow that into the corner, so this 45-degree angle, and that's where your attention's going to be. So it's not perfectly straight on, it's literally just on the corner, 45 degrees. So you're going to get your ball or your foam roller, place it on the area, and just essentially just settle into this just a little bit. You want to take your time with this one because it can be quite uncomfortable. Once you're there, I want you just to tuck your pelvis under very slightly because you're going to start to get into the fibres a touch more. Now, as a pin and stretch technique, you can actually hold on here and then start to tip and tuck the pelvis as you hold, or you can just hold it on at a good kind of intensity, around about a 6 or a 7, and focus on your breathing. With all these releases, you want to be as intentional as you can get. So really feel how it feels, but then really kind of breathe into it and just imagine or visualize them fascial fibers and muscle fibers just kind of opening up and getting a little bit looser. Because don't forget, it's these restrictions that kind of hold the joints back, but you know, you could look at it as like the holders back in life as well. Do this, aim for about 2 minutes to 4 minutes with this one. It doesn't want to be painful where you're struggling to hold it, but it wants to be a little bit of discomfort there so we can add that stress to change the fibers. As always, let us know how you get on.